Hello everyone. So, in this lecture we will discuss about the antifungal agents. In this chapter we will discuss about the fungal infections, what are the forms of the fungal infections and how we will treat these fungal infections. Yes. So, we will start with the overview of fungal infections. Fungi are non-motile eukaryotic single celled or multi, means they are different forms, it can be single celled or the multinucleate organisms. Formally they are classified under the plants, okay, that lack the chlorophyll and cannot perform the photosynthesis. That is why they are parasitic in nature, means they need someone on which they start their growth. Okay. So, they are parasitic in nature and they are causing different type of infections, either it is topical, means it is local infection, or systemic fungal infection, okay, which reaches to blood or to the different organs. So, this is very severe, yes, systemic fungal infection. In patients, especially in the condition where the immunity is low, so AIDS, yes, and there are some other infections as well where the immunity is compromised, patient is compromised with their immunity, at the time they are more prone for getting the fungal infections, okay, and they can be very serious or life threatening. So, we need the treatment for this. Now, what are the forms of the fungal infections, what are the different type? See, athlete's foot, yes, this is the second name or the common name here we are seeing, it is a Tinea pedis, athlete's foot, which is caused by Trichophyton mentagrophytes or Trichophyton rubrum. Okay, this is the local infection, this area we can see, this area is affected here. Okay, that is why it is known athlete's foot, foot area is affected. Okay. After that, there is another infection, ringworm infection, we can see this skin area. Okay. So, this is caused by this Trichophyton mentagrophytes or some other species like Microsporum canis, and it is known as Tinea corporis, yes, which is the second name here is the ringworm, yes. So, it is also a local infection, it is affecting the skin area through the direct skin contact with the infected person. Another is the Brazilian blastomycosis. Okay, this is also one of the fungal infection which is caused by paracoccidioids braziliensis, which is a systemic infection. It is reaching to the blood means, yes, or affecting the organs. So, it is involving the mucous membrane, lymph nodes, bones, lungs. How we are treating it? We are prescribing the Amphotericin B, itraconazole, ketoconazole. Okay, so, these drugs will see in the classification part of the antifungal agents. Now, other infections such as candidiasis, here we can see. So, candidiasis is caused by yeast Candida albicans, this is a fungi Candida albicans, commonly present as saprophyte in GI tract, it can affect the gastrointestinal tract, okay, it can affect the genitourinary system. So, it is topical, means local as well as systemic, okay. It can spread as both ways, yes. Then see mucormycosis. Mucormycosis is caused by mucor, Rhizopus, Absidia, okay, Cunninghamella, this species, with the affected area being sinuses are affected, eyes are affected, blood or brain, it can reach to the brain area also. Yes, this is a very severe infection, it is a life threatening condition. Yes. So, this is the systemic infection. Now, we will see the antifungal drugs. Now, what are the antifungal drugs? These are the drugs which are treating the fungal infection. By acting on the synthesis of the either fungal cell wall, or they can act on the cell wall components, or these drugs can cause effect on the membrane permeability, or they can affect the synthesis of the nucleic acid, they can affect the mitotic spindle function, and ultimately their goal is to inhibit the growth of the or kill the growth of the bacteria. Now see the antifungal drugs. So classification is basically topical versus systemic. For topical infection we are prescribing topical drugs, okay. For systemic infection we have some other formulations. So see, there are two types of drugs. Here first is the naturally occurring, okay. Under the naturally occurring means we are getting it from the living system. So antifungal antibiotics, these are the drugs which we are obtaining from the some of the we are seeing here, there are some of the bacteria like actinomycetes. So what we are getting like Amphotericin B, this is a polyene antimycotic or Nystatin. These two drugs are obtained from actinomycetes. They are under the antifungal antibiotics, okay. Then there are some antifungals which are obtained from the fungus, okay. So this is one of the irony we are seeing here, we are obtaining some of the antifungals from the fungi, okay. So antifungals of fungi origin means Griseofulvin. This is one of the drug which we are obtaining from the Penicillium mold, okay. Now we will see some of the synthetic agents. So under the synthetic agent which is prepared in the labs, okay. So synthetic agents means azoles. Under this we have azoles, imidazoles. Under imidazoles we have clotrimazole, iconazole, miconazole, oxyconazole and ketoconazole. Yes. Under the triazoles, depending on their structures, so fluconazole, itraconazole, voriconazole. There are some drugs which are acting on the metabolite part, so they are known as anti-metabolite, like flucytosine, okay. So they are affecting the DNA basically, RNA or the formation of the proteins which is essential for the growth of the fungi. Now allylamine, allylamine means here we have terbinafine, okay. Then apart from the natural agents and the synthetic agents, we have one new class which is a newest antifungal, Echinocandins. Yes. Now we will see the mechanism of action. So see, this is the mechanism here, we can see the fungal cell, yes. In the fungal cell, there is a DNA, RNA and RNA synthesis, okay. So flucytosine we have already seen in the classification part. This flucytosine is acting as anti-metabolite, so it is affecting DNA, RNA synthesis. If we see on this side, we can see fungal cell membrane and cell wall, yes. Here we can see the proteins, beta glucans and chitin, this is the part of the cell wall, yes. Here we can see the cell membrane area. So this is the cell membrane layer. Now we will see this, there is a one squalene product, okay, which is present in the cell, fungi cell. Now this squalene is converted to squalene epoxide, okay, and this squalene epoxide is converted to lenestrol. This lenestrol is converted to ergostrol. This is all inside the cell, and this ergostrol is beneficial for the formation of cell membrane, yes. Now you can see there are the two classes, first is the terbinafine which is acting on the very initial step where the squalene is formed into a squalene epoxide, it will inhibit this step. So what will happen? The squalene epoxide will not form. If it will not form, of course ergostrol will not form, okay, and this will disrupture, membrane will disrupture. Here we can see on this step where the lenestrol is formed into ergostrol. So azoles are working on it, okay. Azoles will inhibit the formation of this ergostrol. Ultimately the membrane will rupture. Now we will see the Amphotericin B and Nystatin. What they will do? They will cause the imbalance in this area. We can see in this cell membrane layer. What they are causing? They will enter inside the cell, okay, and then disrupture the cell membrane, okay, Amphotericin B and Nystatin. You will see on this area there is a Echinocandins which is a newest antifungal. Now Echinocandins is inhibiting the enzyme beta glucan synthase. This beta glucan synthesis is essential, this green color structure which we are seeing on the very top. Okay. So, this enzyme is essential for the formation of beta glucans, which is important for linking and maintaining the rigidity of the cell. Okay. So, if this is inhibited, this enzyme is inhibited, what will happen? This beta glucans will not form, okay, and the rigidity will be lost, the cell will die. Okay. So, this is the mechanism of action of the drugs which I have discussed. So, let us start with the amphotericin first. Amphotericin is obtained from some of the cultures of Streptomyces nodosus, yes, and the mechanism is very similar which I told you. It has a high affinity for ergosterol which is present in the fungal cell membrane. It is forming the micropore and it will enter the cell and disrupture the cell. Okay. There are various infections for which it can be used. It can be used for the infection which are topical or local infection or systemic. So, Candida albicans, other Histoplasma capsulatum, Cryptococcus neoformans which is affecting brain area, okay, and Blastomyces dermatitis, this is affecting the local areas, Coccidioides semitis, Torulopsis, Rhodiotorula, Aspergillus and Sporothrix. These are some of the species which is causing fungal infection. So, this drug is effective against these species, yes. Now, it does not have any antibacterial property. It is most effective drug against the resistance cases of leishmania, yes. So, leishmania which is caused by the leishmania, Donovali or some other species are also involved under this. There are two types of leishmania we have seen, is the visceral leishmania or the cutaneous or mucocutaneous leishmania. So, it is effective against this condition, Kala-Azar, which is a visceral leishmania or mucocutaneous leishmaniasis. Now, what is the kinetic? A pharmacokinetic. So, we will see amphotericin B is not absorbed orally. So, there are some other formulations which we have prepared, and we need to prepare some novel formulations as well as for the amphotericin, because it is one of the effective drug. So, it is administered IV and rarely intrathecally. Half life is nearly 15 days, excretion is through urine. Penetration to CNS is poor and 60% of amphotericin B is metabolized by liver. Now, what are the side effects of amphotericin? So, first or most important side effect which we have seen in the patients is nephrotoxicity, most important. It will cause kidney damage, yes. Acute reactions can occur, okay. So, there will be fever, chills and fevers, aches, pain will be there, nausea, vomiting, okay, trouble in breathing, which is lasting for 1 hour or probably due to release of cytokines, inflammatory mediators, yes. How will reduce these side effects? Of course, when will reduce the dose? How will reduce the dose? We can form some lipid complex or colloidal dispersion, yes. We can also form some small unilaminar vesicles which are given at targeted site. What is important here? Irreversible renal toxicity can result if cumulative dose is nearly 4 gram, yes. Now, what are the formulations like Ambisome, which is liposome based. So, it is one of the targeted delivery, means we have prepared this for targeted delivery. Now, see the another drug, Nystatin. Nystatin is also one of the under the natural derivative. So, Nystatin is fungicidal. It is derived from Streptomyces nodosi, yes. It has a high systemic toxicity, that is why it is commonly preferred for topical formulation, okay. It is given as topically. What is the mechanism? The same mechanism. It has a high affinity for the ergosterol, and it will form the micropore, it will enter the cell and starts to disrupt the cell membrane. What is the indication for which of the infection it can be given? So, like monilial vaginitis, okay, corneal conjunctival or cutaneous candidiasis, which is caused by candida albicans. Yes, it is used in the ointment form. Yes. Now see Griseofulvin. Griseofulvin is another natural compound which is obtained from one of the fungi. So Griseofulvin is a narrow spectrum antifungal obtained from Penicillium griseofulvum, where it can be used like dermatophytes, okay, which is affecting the skin area, including epidermophyton, trichophyton, microsporum, but it is not effective against the systemic infection which is causing the deep mycosis. Then see what is the mechanism of the Griseofulvin. It is not clear, but some literature which are showing that they are interfering with the mitosis part. Yes, they are affecting the mitosis, and they in this procedure when they are interfering the mitosis, they are forming the fungal hyphae, the filamentous structures they are forming. It also causes abnormal metaphase in the division of the cells by acting in such a way that the daughter nuclei fail to move apart or the cell will not form. Okay. So, the fungi will not grow further. This is the mechanism of Griseofulvin here. Now, see the absorption of this drug, we can improve it by some of the fatty meal. Okay. So, there we need to remember one point: absorption of drug improved with a fatty meal. Yes. Now, I will see what are the side effects or the adverse drug reaction. So, Griseofulvin gets deposited in the keratin, forming cells of the skin, hair and nails. So, it is started to deposit on those of the areas. So, most of the side effects are related with these areas only. Yes. Now, see the side effects. Drugs causes gastrointestinal upsets, there will be headache and photosensitivity, which I told you, some of the allergic reactions like rashes and fever. Okay. The drug is contraindicated in pregnant women, important point. Now, see another azoles and triazoles. I told you the azoles are working on the step where the lenostrol is converted to ergostrol, which is essential component of the cell membrane. So, the same is written here. They are synthesized derived antifungal agents, orally or topically it can be given for infection which are caused by the dermatophytes, candida, fungi involved in deep mycosis, nocardia, gram positive or anaerobic bacteria which are caused by the streptococcus aureus or enterococcus which is affecting the intestine, bacteroides fragilis, this is also affecting the intestinal area. Patients are acquiring generally at the time of surgery or trauma, and leishmania infection. Okay. What is the mechanism? Same mechanism, they are inhibiting the CYP-P450 enzyme. Okay. This enzyme, this is basically important for the conversion of lenostrol to ergostrol. Yes. Now, see Flucytosine. So, Flucytosine, it is one of the anti-metabolite. Inside the cell, it will undergo the conversion. So, Flucytosine is converted to 5-fluorouracil inside the fungal cell. Okay. Then this 5-fluorouracil is converted to 5-fluorodeoxyuridine monophosphate. This is essential for the formation of DNA, RNA and the formation of further protein synthesis. So, what will happen? This 5-fluorodeoxyuridine monophosphate, which has a similar resemblance with the DNA or RNA which is present in the fungal cell, they will take that site. Okay. So, what will happen when they will take that site? They will start to inhibit the further formation of the DNA, RNA and proteins, means whatever the products will be formed, that will be defunctional. Okay. Of course, after the formation of defunctional product, the cell will die, it will not stay for a longer time. Now, see the side effects. What are the side effects written here? Like bone marrow depression and liver dysfunction. Okay, there will be baldness also, alopecia. The last drug under this is terbinafine. Terbinafine is a fungicidal drug which is affecting on the very initial step where the squalene is converted to squalene epoxide. Okay. So, terbinafine it will affect on this step, it will inhibit this step, yes. So, the same is written, it is an inhibitor of squalene epoxide, and accumulation of toxic squalene, it will cause the death of the fungus cell, yes. Last is the Echinocandins, which is the newest drug. So, it is inhibiting the beta glucan synthesis, yes, and ultimately beta glucans will not form. It is active against the Candida, Aspergillus species, Pneumocystis, pneumonia infection which is caused by one of the fungi, Aspergillus species, but it is not effective against one of the systemic infection which is caused by Cryptococcus neoformans, yes. We will see the side effects. So, there will be headache and flushing, okay. There are some GI infection, GI effects also, like nausea, loss of appetite, okay. There will be vomiting. So, these are some of the side effects like gastric upset, rash, taste disturbance, okay, hematological disorder, hepatic dysfunction. Thank you so much everyone. I hope this is clear to all of you. What are the various antifungal agents, what is the mechanism of action, how they are working, and what are the side effects of these drugs. Okay, we will meet in the next session.